It is season 2, episode 11. It is 6 degrees. It is cold outside, but we are having some not heated conversations. We're just having some warm conversations. And thank you so much for being with us. And this is a doctor that I met in person last week. Thank you so much, doctor.
It's great to be with you.
Thank you. And so you are the founder of Breasts4LIFE.
Correct.
And this is about thermal imaging, but being proactive instead of reactive and kind of holistic.
Yeah. So let me take it to the beginning. We currently have a system right now where we wait till usually a woman is age 40. She goes in for her first mammogram, and they're taking pictures of the physical tissue, looking for stuff that's out of place, maybe a tumor, maybe a cyst, something along those lines. Let's say they find something. It's the size of a pea or a pebble. They're not sure what it is. They decide to do a biopsy. That's taking a small sample using a needle. They look at it under a microscope and they say, uh-oh, this looks like malignant cells, cancerous cells. That's a different conversation to have at that point. What we know, though, is that process didn't start overnight. And so to wait to that point where we can see something on an x-ray or a mammogram seems to be the seek and destroy method that we currently are under. And when I say seek and destroy is we wait to find something and then we aim our radiation, our chemotherapy, and try to essentially destroy that thing that we saw. Well, there might be a better way. And so that better way hopefully is going to be more of a preserve and protect rather than a seek and destroy. So our technology, not really ours, this technology has been around since the early 80s, was approved back in 1982 by the FDA as an adjunct to mammograms. And so the best way that I can describe the difference between a mammogram and a thermal image is using the following analogy. So let's pretend you and I are in a hot air balloon, okay? We're high up in the sky.
Okay.
Below us is a big storm. It's like a hurricane. You see the clouds, the ground, the water. And in our hand, we have a Polaroid camera. I know you know what that is because I know what that is. Okay. Sometimes not everybody knows, but I'm going to take a hunch. Okay. So we point it down at that storm and we take a picture and we look at that picture. What are we going to see? Exactly what you would expect. The clouds, the ground, the water. And that's, again, what a mammogram, ultrasound, and MRI are doing for us. They're giving us a picture of the stuff that's there, the structure of things. What does it look like? Okay. So assume we're in that same hot air balloon, same storm. This time we have an instrument that tells us how fast the wind is going, how much rain is falling, or what the temperatures are in the storm. So now it's not so much what does the storm look like, it's what is the storm doing. So it's functional information rather than structural. So when you're evaluating a storm, what's it better to have? One piece of information or both sitting on top of each other? Clearly you want to know what does it look like and what is it doing.
Right.
Okay, so for our conversation, if they identify something on a mammogram at age 40, that means that process didn't start overnight, that it took up to 10 years for that area to actually prime itself to develop and actually support a tumor. So the question is what's happening during those years of priming, if you will. Okay. And the answer is functional changes, usually in the form of inflammation or blood flow, blood vessel, circulatory changes. And with added inflammation and blood flow changes, guess what you're going to get? More heat. So we can see hot spots, we can see patterns developing and changing. And so this ultimately allows us to assign a risk level to each side on a scale of 1 to 5 we use. 1 is the lowest risk, 5 is the highest. Of course, we want to see everybody in the low risk, but oftentimes we'll see medium and we will see high. And there will be no structural issues. Like they'll go for a mammogram, they'll go for an ultrasound, and nothing will show itself as being structurally changed, which is the best news that you can get because guess what? When you're still in that functional stage, that's when you can start doing things to actually change it. And that's where the holistic component comes in because typically your breasts are not vital organs, right? So they're the canaries in the coal mine. So if they're showing signs of dysfunction, disability, or abnormal heat patterns, hot spots, we usually know that the systems that support them typically are not in a happy place, whether there's toxins, whether there's things like parasites and mold and all kinds of deficiencies. And these things will kind of come together like a perfect storm. And so if you can begin to unwind this while you're still in that functional state, you can actually see these levels, these risk levels drop. And the significance of this cannot be understated. Let me give you an example. Let's say you have two women who are standing side by side. One has a strong family history of breast cancer. Her grandmother, her mother, her aunt, her sister. but she comes in at a low thermal risk, okay? Here's another lady that has 0 family history of breast cancer, but yet she has a personal thermal risk of 4, which is considered high. Okay. Now, she's 8 times more likely to get breast cancer than the woman that has a significant family history and a personal low thermal risk. So if you know where you stand, regardless of family history, it's much better to know where you are so that you can really empower yourself to make better decisions and guide your healthcare instead of just sort of being sort of stuck in that seek and destroy system where you really don't know what's what until it might be too late.
Well, I think too, when you get a diagnosis, then you're in that fight or flight mode, or, you're panicked, right? So this is a way to kind of, it might be scary. It's non-invasive. Right. Right?
100% safe. It's 100% radiation free. It's 100% private. Nobody touches you. Nothing touches you. You're in a completely private, enclosed area the whole time. I always say if all the women of the world got together to create their own test for breast health, this might be the closest thing to perfection. Although it does not diagnose, just like mammograms do not diagnose. The only way to truly diagnose any kind of cancer is, of course, through biopsy. But it's the only test that allows us to see function and allow us to assess real-time risk.
And, so say I come in and your levels are what, 1 through 5?
1 through 5,
1 through 5. So I come in at a 4. So what's the next step from that?
So the recommendation when you're a 4 or a 5 is to reevaluate in 3 months, to do a closer evaluation to make sure that these levels are not moving at any type of accelerated rate. Of course, we'll always recommend that you follow up with some kind of structural imaging. Usually people that come for thermal imaging have apprehensions about mammograms, but sometimes when they see evidence on a thermal image, it makes sense for them to go have a mammogram at that point. But if they don't, we always recommend following up with an ultrasound, which is also a very beneficial test and allows them to evaluate the structural aspect of the tissue. And so once you rule any structural problems, then you start asking those questions. That's when you start going into more of the holistic evaluation and finding out what symptoms, what other functional problems that person is having, and you evaluate them and you give them a plan to help improve their risk.
Okay, so let's talk about the whole age for mammograms. I know that this, it seems like it has changed back and forth. And what is the ideal age for a woman to come in and have this done with you?
So the international guidelines actually recommend that when a woman hits age 20, that she has her first thermal imaging, okay? Now, assuming everything comes back low risk, we recommend every 3 years while you're in your 20s. This is to establish a healthy baseline. Once you hit age 30, it's recommended, again, assuming low risk, a 1 or a 2, we recommend once a year after that. And if you come in at a 3, it's a 6-month evaluation. A 4 or a 5 is a 3-month reevaluation. And typically, once we identify certain patterns have sort of stabilized or leveled off, then we begin to kind of open up those follow-up recommendations.
Okay, so thank you for clarifying that.
Yeah, no problem.
But 20 is kind of crazy, right? Because it's like, really? I can't imagine my 20-year-old self being like, I'm just going to go do this.
Exactly.
So how do you get that message out?
As far as...
Well, this is important and preventative almost.
Oh, well, we get the message out through doing fantastic programs like yours, of course. And I do a lot of community-based workshops, and I'm starting to get into the whole video creation and whatnot. I'm about 15 years too late, but that's okay. I'm slow with these things. But really, most of ours is through word of mouth and through a lot of networking that we do with holistic practitioners as well. So, yeah.
Well, I think it's important. So the Chamber of Commerce is the one who connected us.
Correct.
And I think it's important to note that a lot of these tests and stuff is super expensive, right? And insurance doesn't always cover. But you, compared to pricing that I've seen, are super reasonable. Yeah, I will just say that straight
Well,
out.
You're being kind because super reasonable can be really, really expensive to some people.
No, I get that.
I'm just kidding.
Thousands as opposed to hundreds.
Correct. So an annual evaluation costs $295. So it's under $300 for this test, and it takes about 30 minutes to do, and that's from beginning to end.
What are how quick is the turnaround on results?
We usually get the results back to you within about 7 business days.
Okay.
And then you have the full opportunity to review those results and contact us and discuss next steps, next moves. And that's all part of that evaluation.
Okay, so the evaluation, reasonable to me. I know, like how you just said, it may not be reasonable to other people, but you do have something special going, and I'm grateful for this.
Oh, yeah. So we have 150 spots available. If you use coupon code Brooke75, it reduces your rate from $295 to $225. So it takes off, no, $220. It takes $75 off. So it's a $75 coupon that takes...
See, I come in handy.
From the original $295. Easy for me to say.
Yeah.
First day with my new mouth, excuse me.
It's okay.
Sorry.
Well, that is awesome, and I appreciate that. I already know, I have been talking to people, people always ask me, oh, who's on the show, what's coming up? And then I had mentioned you several times, and I had, I think, 2 different women say, oh, you know what, I am going to check that out.
I'm glad to hear that. That's
so
great.
thank you. Yeah, thank you for that deal.
Well, thank you for the opportunity.
That.
It's great to be with you today.
Okay, so one piece of advice you have to every woman, regardless of their physical health, what is it?
One piece of advice to women? Mm-hmm. Am I assuming that they're going to listen? I'm just kidding. Okay.
Oh, step outside, sir.
Hey, just take it easy. Okay. Be authentic. And if you have something to say, don't be afraid to say it. Because oftentimes, in my personal opinion, in my experience, a lot of physical ailments can stem from repressed speech and thoughts and feelings. So that's probably where I would start with anybody.
Awesome. Thank you so much.
You didn't think it would start there, did you?
I did not. I was I'm like, oh, that's deep. Thank you so much.
Thank
Give me
you
the
so
website
much.
where people can reach out to you.
So the website is Breasts4LIFE.com. That's breasts plural, the number 4, and then the word life.com.
Okay, and you're located?
We have a main office in Highland, Michigan, but we have also satellite offices, 2 in Ann Arbor and 1 in Saline.
Okay,
Yeah.
awesome. Thank you so much,
Thank you so
Doctor.
much, Brooke.
I appreciate it.
All right.